Hello, this is Daniel Knowles with a training on examples of instrumentation and assessments utilizing network spinal analysis basic care. And this goes through particularly EMG, electromyography, thermography, and x-ray changes, which are all great tools to utilize as outcome assessments with network spinal analysis in a chiropractic practice model. There are certainly more tools that you can utilize. I want to give you a context that you can use these tools in, as well as a context that you'll be able to apply in other areas. And that context or window that you want to utilize is the model of the triad of change. It creates an incredible depth of conversation and relationship between you and the practice member and their spine when you talk about care in terms of structure, perception, and behavior, and they get a much more whole picture of their care rather than a segmental view, which we want them to move away from. Now let's start looking at this first picture, and this picture is of a 3-year-old girl, and the 3-year-old girl is having initial complaints of not being able to sleep through the night, digestive challenges, multiple infections, and the doctors attributed this to a quote-unquote weak immune system. That's what the parents were told. And so the initial readings are at the top. So this is when they first came in with the weak immune system. I will call this a weak nerve system looking at the findings. Now, so if you've never looked at these kind of findings before, so you have a little frame of reference, you're looking at these from the back. So your left is the person's left, your right is the person's left. This is based on normative data for the subluxation station and electromyography use that was done by Christopher Kent. And the normative data put the color scale into white, green, blue, and red, which are standard deviations. White within a normal range, green was abnormal, 1 standard deviation from normal, blue was 2 standard deviations, red was 3 standard deviations. More than 3 standard deviations is black, so those are the most serious levels of findings. Now, what I want you to look at through here is use this in a context of behavior. Now, behavior is what is the behavior pattern in the neuromuscular system, the neural control system, and the active subsystem. Now, if you look at the upper left picture, you'll see green, blue, red, black. Those are very high readings. I'll communicate these practice to practice as green is abnormal, blue is very high, red is severe. That's the language I use. Green is abnormal, blue is very high, red is severe, black is beyond that scale. White is within a healthy range. And then if you look to that upper left one, you can see there's even excessive activity in the lower cervicals compared to the lumbars, and you also can see that there's more activity on the left in the lumbars than to the right. However, you look at the picture in the upper right, what you can see more easily is this is called the symmetry or asymmetry chart. It's the same data from the left. However, the spikes indicate which direction has more activity. So if you look at C1 in the upper left picture, green and red, obviously there's more activity on the C1 on the right. If you look at the picture in the upper right corner, you can see that that actually equates to 45%. So C1, C5, T1, that whole range of the shoulder blades up has excessively high readings or excessively abnormal. Once you get above a 20% difference, you get a green spike. Now you go right between the shoulder blades down, everything from that side down is on the left. That's interesting. That's not a normal distribution or an ideal distribution. So that kind of activity tells me very clearly that the upper torso is doing one thing and the lower torso is doing another, which is going to put a maximal kind of force in the middle. Now, if we go to the next set of pictures at the bottom, these are just a few months later, not even 2 months. And if you look at the left side of this image, the lower one on the left, obviously the activity in the electromyograph reading has become less intense. And that's how we communicate care. Intensity. Is intensity decreasing? And that the person shows signs of meeting the goals of, for example, the basic level of care, we're going to see signs that there's less tension or less intense readings. Now, I also want to mention something about the yellow because I didn't describe describe that. Remember I said white was within the normative data? Yellow is actually lower or sub or hypotonic to what was considered normative on the population in the studies. Now that's very interesting because as people receive network care, I tend to see very frequently their readings get to the yellow range or below what was considered normative. Now, important thing about that normative study was that it was based on people that didn't have trauma in their history and a few other factors. So that's an average population in the US that didn't have trauma in the histories. I would like to think that with network care, we're getting to a level of spinal integrity that's better than what's considered the baseline of most of America that probably has subluxated spines. Now, so I'll consider yellow in this case as a person progresses that not it's hypotonic, but they're actually doing better than what we've seen in the normative data. Now, when we go to the lower right, here's what I want you to look at. Look at the shape of the readings compared to the shape of the ones initially in June in the upper right. So upper right, old, lower right, new, or pre and post. And so you can see that the shape has literally changed. C1, C5, T1 are the complete opposite direction, and the thoracics, mid-thoracics down are also in the complete opposite direction. So this tells me that not only is the person reduced their activity or their intensity, they've actually also changed behavior. And that change in behavior pattern is crucial to point out, because it means their body's reorganizing or organizing a different matter. Now, I'll also say something else about looking at these particular pictures. If you notice the tug of war, so to speak, but the center point of that change or transition is still in the same region, which is that mid-thoracics, which is going to tell me, though it is reorganizing, there's still some level of bound up energy either in the active subsystem or the passive subsystem or the neural control subsystem that's affecting that region kind of as a pivot point. Now, if we go into the next slide, this top slide is the same slide as you saw in the last picture. The top pictures, that's what we were just looking at as the post. So now, if we look, this is further down the line several months later as the bottom ones. You can see that the person's continuing to progress. If you look at the pictures on the left, the intensity is continuing to improve. So this is where you start to realize that a person continues to progress as they continue to receive care. Also, if you look at the slides on the right, that shape that we were looking at is completely reorganized. If you go top to bottom, you see C1 left, C5 right, T1 left, T4 right, and the readings alternating along the center. That pivot point that we're seeing in the mid-thoracics is no longer there. The person's body, this young girl, is having an incredible change of reading. So there's a significant change and in that progress. Also, an initial thing that